Sinusitis that does not clear after several months, multiple courses of antibiotics, may require a surgical solution. Now, some of those surgical solutions can be minimally invasive and performed in the office. There are some newer techniques using balloon, similar to the balloon technology that's used to dilate small vessels in the heart to unblock the heart block or heart artery blockages. It's very similar as far as the design, and I'll show you that here in a second. And these procedures can be done in the office. There's also endoscopic sinus surgery procedure that's done when you're asleep. And typically that surgery is done with an image guidance system. It's basically a specialized guidance system that helps to navigate through the sinuses to allow for a more aggressive approach to removing the diseased tissue and reduce the likelihood of recurrence. So for some people, surgery may be an option to help improve their symptoms because their sinus tracts may be so small that they're going to be prone to recurrent infections regardless of what you do to treat the problems, including repeated episodes of antibiotic treatments as well as allergy treatment. So despite all that, some people still need some type of surgical option to help them with their sinus condition. The balloon sinus dilation is performed in the office with local anesthetic, so there's minimal downtime. It's minimally invasive. There's minimal bleeding, which is all a good thing. Recovery time is usually a day. Usually go back to work the next day. And it doesn't limit anything else to be done in the future if you have to have a more aggressive approach to treatment. So this is one manufacturer that makes a balloon system, and I'll show you that balloon here in a second and show you how it works. But basically the balloon is introduced into the nasal cavity, and there's a little lighted guide wire that's used to find the opening to the sinus. See, now it just found the opening to the frontal sinus, and once it's in the frontal sinus, the balloon is advanced over top of that guide wire and inflated. And so the inflation actually spreads the bone open, as you saw there, and makes that opening wider, that funnel, that end of that funnel wider. And then the sinus can be irrigated and mucus can flow out of that sinus much more easily and allow for some improvement of your symptoms. Now that the sinusitis does not resolve overnight. It took months to develop. It may probably take months to resolve as far as the chronic inflammation. And I'll show you that device here. So here's the actual device here that's used. All right, and the advancement of the device that has a little guide wire here, and there's the little balloon device that comes out, and then that balloon is inflated with. You just usually have somebody else here to do it, but it will serve the purpose. The balloon will inflate by using water to inflate the balloon. So it gets very hard, and so people wonder how does that mold or change the structure of bone? Well, the bones inside the sinuses are very, very thin, and so it does not require a lot of pressure. It requires a significant amount. I just inflated that to about 12 atmospheres of pressure, which is a significant amount of pressure. So, but that's enough. It's enough to actually spread that bone out. Those bones, again, are very thin. In some areas, they're as thin as eggshell. Okay. Some people aren't candidates for this option because of other problems such as polyps or severe sinus disease, and the balloon sinuplasty can be used in certain cases. Those who have more advanced sinus disease would benefit from surgically treating the sinuses endoscopically while you're asleep. And this, this method, we use scopes and videos and small instruments, and there's no cutting on the outside. Everything's done through small scopes and small instruments inside the nose. And Again, this is an outpatient surgery. Most patients go home the same day from this surgery with minimal pain. The other system that we use is a guidance system, an image guidance system, which basically is a 3D computer animation used from a CT scan that was obtained preoperatively to help with guiding the surgeon intraoperatively to the diseased areas to remove as much tissue as possible without causing injury to you. So, surgical candidates for sinus surgery include recurrent sinus infections, regardless of non-surgical treatments, such as medication or allergy shots. People who have had sinus infections or get sinus infections more than 4 times a year would probably benefit from one of these procedures. If there's evidence of a fungal process going on a CT scan, then that's a reason that you actually should have sinus surgery to basically remove that fungus. So, and people that don't have that have polyps that cause nasal airway blockage and can also cause a loss of sense of smell, they are also considered candidates for surgery on their sinuses.